are from Franciscan Health Foundation, and that's what they're going to tell us about. Sandy Howarth is a registered nurse, and she will be introducing the rest of the ladies.
Okay, I have to correct something. I am not a registered nurse. I don't know if Jeff wants me to be one, but my daughter is one, and she's actually in the process of studying to get her nurse practitioners. So that will be a doctorate degree. So unfortunately, she does not live here. She lives in Sellersburg, but everybody at the hospital, when they find out that she's studying that degree, they're like, when does she graduate? I'm like, she doesn't live here. We can't hire her. Before I start, I want to say thank you, first of all, for allowing us to participate in your meeting today. And I have to say, at Franciscan, we always start meetings with prayers, but we never sing. So that was really fun for Jennifer and I. And I would like to introduce Jennifer Everly. She is my counterpart at the Health Foundation, and she also wrote the grant that you all approved. And the resources from that grant went into our sensory room for equipment, and so Dusty Chase is the supervisor of our outpatient therapy, and she's got a presentation as well about how the funds were utilized, and so you can actually see where your money went, which I think is important to understand the impact. So when Jeff talked to me about doing this presentation, and this was all via text, by the way, if you know Jeff, there's a lot of texting going on, and we kind of joke back and forth about that. And so he texted me, he said, I need to know what your presentation title is going to be. And I'm in a meeting, and I'm like, okay, give me some time to think about that. About 20 minutes later, he's like, do you know your title yet? Okay, I'm going to do it on the 5 questions that we get asked, 5 things you should know about the foundation. And quite honestly, these are actual questions that Jennifer and I get all the time. So the first one, so I should be able to. That's the beginning. That's the first slide. Okay. I love technology. So the first thing is people often ask us, why do you need a foundation at the hospital? The sisters have a lot of money. Why do you need our money? Well, I think people don't know our mission. We're kind of like the best kept secret in town in some ways. And so you can see our mission up there is continuing Christ's ministry in our Franciscan tradition. And so we do that by raising money and expending those funds to support the programs and services of Franciscan Health. So as we talk today, I'll share some of those programs with you and where the money goes and where it comes from. So who are we? We are one of 4 foundations within the Franciscan system. We have our corporate office up in Mishawaka. We do not have a hospital up there, though, which is always a fun fact for us. We're like, why are our corporate offices up there? But actually, there was a family who had a very large mansion in Mishawaka, and they actually donated it to the sisters, and that became the mother house and where our corporate offices are. So we are the Western Indiana Division, as you can see on the lower right-hand corner. So that includes our hospitals here in Lafayette, so the central location and the location that's called East, which is on Creasy, and our Crawfordsville Hospital and Rensselaer Hospital. So the counties that we serve, Tippecanoe, Jasper, Montgomery, but we'll get patients that come in from outside of those counties as well. And the thing about Franciscan Hospital, and quite honestly, I am Catholic and I did not know this until I came to work here, is we take care of all patients who present themselves to the hospital. So that means people who do have insurance, people who have some insurance and might be qualified as underinsured, and as well as those who have no insurance at all. And we are the only hospital that handles all of those types of people. So that's the best kept secret as well. Jennifer, do you have anything to add to that?
We have a corporate office and we have the three other divisions of the foundation, but any money that is donated will stay local, and not all hospital foundations can say that. So I'm very proud of how our hospital has organized the foundation, because it would be very hard with 14 hospitals in the alliance for Sandy or myself to be able to cover all 14. So they put offices in 4 central locations, but all the money that we raise stays local, and that's very important. None of it, generates or goes up to corporate and stays there and trickles back down, because some hospital foundations do operate like that, but ours does not. It stays local, and it goes to directly what the donor has intended it to be for.
Correct, thank you. That's a good point. So we do get asked that question a lot, like, does our money go to the corporate? No, it stays here. All the gifts that we receive, so for example, the grant money that we receive stays here in our Western Indiana division.
If we want to give money to the corporate, though, we can, right?
You absolutely can, but we prefer that you give it to the Western Indiana division. Do we need to talk later on? I'll see you after class. The other question is, well, who do you serve? And we've talked about that a little bit, about the different types of patients that might present to us. The other thing I want to share with you is I've had some development history in education at Purdue and Ivy Tech as well, and Jen has as well at Indiana Wesleyan. So I liken the foundation's need to raise money to academia, because when I was at Purdue, each year the state appropriations would dwindle percentage by percentage or multiple percentages. So that made our job in development even more critical. And Mitch is doing a great job on raising money for Purdue. So the same thing is happening to us, but it's ours is not the state, it's the insurers. And each year they're deciding more and more about what they're going to pay and not pay on, and the level that they're going to pay. And you might have heard recently, I think it started in Atlanta, where they, and I think this was Anthem, started making decisions about people presenting at the emergency room and what they were going to pay and not pay. What they were considering were true emergency situations or not. So that's starting here in Indiana as well. Now granted, we do have people that present at the emergency room that maybe should have gone to the express care, but sometimes people don't know that. And so they could actually get penalized in some ways from how the insurers are paying. So that's our problem, that's our challenge, and that's another reason why we need the foundation to help raise funds, because we will then support those people who are underinsured or have no insurance at all. So who we serve, I'm just going to pop all these up here real quick. So we have what's called the PEACE Initiative, and it's an acronym for us. And as you can see, it stands for Protect, Elevate, Assist, Comfort, and Educate. So we have programs that are related to each one of these words. So under Protect, it says our most valuable communities by providing access to safe, nurturing environments. So areas that we raise funds for are behavioral health, our GRACE project, which you may or may not have heard of, which is a program that we raise money for that helps the opioid moms and babies. And we recently had Dr. Tolles that presented at the board meeting, and she shared with us that 12% of the babies born in Tippecanoe County, 12% are opioid addicted when they're born.
It's sad.
It's a staggering percentage. So the funds that we raise for that program assist the moms and the babies with medical needs, medications to basically detox and come off of the medication. And that's not an easy process. And oftentimes those babies will be in the NICU for up to 2 weeks. And I don't know if you've ever heard or know anything about opioid addicted babies. They cry, and they cry 24/7 for several days. So imagine being a nurse in that unit. I mean, it's hard enough to hear your own baby cry very long, let alone a room full. I see a lot of head shaking on that. So, that's another thing. We have a nursing excellence fund. So we are supporting our nurses, believe it or not. It could be a situation where our nurses are the sole provider for their family. And maybe they need new scrubs or a new stethoscope, and they can't financially afford to do that. So we have a fund that helps it. We have a fund that helps our patients. Some patients, when they are discharged, they do not have the resources to pay for their medications or equipment that they might need when they go home. We have a fund that helps and takes care of that for them. So I could go on and on. We have throughout our own division, we have over 60, I believe, funds, and I don't know them all by heart. I've only been here 8 months. But basically, we help patients, we help our employees. We have employees who sometimes are in financial need, and we have a fund that assists them. We also have funds that help with education. Whether we have one that's for degree seeking to help our employees seek a degree, nursing, whatever, as long as it's in the health field. And we also have another fund that helps for certifications or recertifications for non-degree seeking. So there's a lot of things that we're doing to make our staff happy, healthy employees and retain them, as well as things that we are doing to help our patients. So I'm going to skip ahead because I'm probably taking up more time than I should be. The next question is, where does the money come from? And as you can see on this slide, we get estate gifts, we get grants from the government. There's businesses and corporations in town that sponsor events for us, or they give a gift to a program that's important to them. Foundations, employees. Our employees are amazing. Jen and I both have this little heart on right now on our name badges, and that is that we're signifying that we have been donors to our staff campaign that we are in this month. And if we look a little blurry-eyed, it's because it's been pretty busy this month for us. So our staff, we have a financial goal that we're trying to raise $1 million this year. A quarter of that we are raising with our own staff. So that should tell you volumes about our staff and their support of what the work that the foundation does. So civic organizations such as you, individuals, vendors, medical groups, and just other people who just have heard of us and they want to make a gift. So questions on anything I've said so far? So the fifth thing is, where does the money go? We hear that a lot. So you get all this money, where is it going? So a percentage of it is going towards construction, renovation, and equipment. You have to keep things up to date and repaired. So we've raised money for, if you may have noticed, the new School of Nursing. So we've actually renovated a part of the central campus. If you want to come look at that, please email one of us, because that's a phenomenal facility. It's got a state-of-the-art sim lab in it that our nurses are being trained on, and actually we bring staff over from the hospital and train them on this equipment as well. There's conversations going on about Purdue and Ivy Tech also accessing our sim lab because it is that incredible. So, let's see what else there is there. Yeah. So this is just a graph of showing the money that we raised last year, that 5.5 million, and how it breaks down percentage-wise where it went. So you can see the big chunks are capital, hospital department, patient care programs, and then community outreach and patient assistance are the big ones. And those are traditionally kind of our bigger fundraiser buckets as well. That's where we tend to raise most of the money. So this is our team. This is me, Jennifer here, and our assistant Cindy. We were all having really good hair days that day. But we're a mighty team of three, I always say. And you think about, we're trying to raise $1 million. And truly, it's Jennifer and I, they're the two that are raising funds. We are very, very busy. But we're happy doing what we do. We love it. So again, this just is highlighting some of the major funds that we have here in our division. The patient fund, the employee emergency assistance fund, the NICU and pediatric fund, our School of Nursing. We actually fundraise for scholarships for our School of Nursing, cancer care, community education, palliative and hospice, and our staff education. So those are kind of the big buckets. We also have a medical missions fund that our doctors can access, and they can go to third world countries and assist and do mission trips, medical mission trips. So if you want to get in touch with us, here's the way you can do that. Jennifer and I both have business cards if you want one from us today, but we're not going to lay them out. But if you want one, just let us know and we'll give you one. Questions? That's kind of what we do in a nutshell. Yes?
What you were saying about the 12%, was that the whole area, Bergen County, or was that just the ones that came to your hospital, or?
Presenting at our hospital. And you'd be surprised, I think the biggest thing we learned that day, not only the percentage, but the people who are coming and presenting. It could be your next door neighbor. You know, opioids, the problem, it's no big secret. You read about it in the paper almost weekly. You hear about it on the news. Soccer moms, again, your next door neighbor. It's surprising who presents with that particular issue. So we're really trying to focus on that as a hospital system, and especially here in Western Indiana. One of the things we're doing is we're in the process of fundraising for what we're calling the Crisis Stabilization Unit. So that will be an area where people, instead of going to the emergency when they come, they can go to the Crisis Stabilization Unit. It's a place that they can calm down, we can get them their proper medications, and then work up a treatment plan for them, and they'll be outpatient. That's not an inpatient situation. But there's nothing like that in this state right now. We'll be the first one in the state to have that. Yes?
One of the areas that you fund is palliative care.
Mhm.
Can you explain how that works at St. E's?
Sure, and actually, Jennifer, I might call on you to help me out on this a little bit. So, Dr. May is the head of our palliative care area. So we actually, in the new wing that we just opened up, we have a wing that's specific. There's a group of rooms that are specific just for palliative care. So and it doesn't have to be necessarily cancer. There are other diseases that occur that there's a time frame to them, and and at some point you need to have more constant care. And so we have a wing that allows for patients to stay. Families can stay there as well. There's actually a little office space where the family member could go and shut the door, but still be in the room with the family member, but get work done if you need to, or make a phone call or whatever. It's almost like a small little hotel room, actually. So I'm not sure, did that answer your question?
So you've got to be terminal to go there?
I believe that's, well, your thought. I was gonna say yes, but.
A lot of
Give her the microphone. Give her the microphone.
You know, there's a lot of questions like what's the difference between hospice and palliative care? And when people are put on hospice, it's, there's no resuscitation, you can do it in their home. With palliative care, you may just have a terminal diagnosis, but that doesn't mean that your quality of life maybe has not totally come to impact. You might have quite a few years left to live, but you are going to be under that palliative care treatment until maybe you need to be put onto hospice. The suites, though, are for those who don't want to go home and do home care hospice, but have a more dire need and have to be in the hospital towards their end of life, so that we are giving them the most respect that they have in their remaining hours. So not everybody can do a home care hospice. Some people need to be in the hospital. We call that the palliative care suites. However, there's a differentiation between hospice and palliative care. Hospice tends to be where you have limited time. Palliative care treatment may be where you have a terminal diagnosis, but we're not quite sure as to when you may pass. So, does that explain it? It's a question. I actually asked that same question when I started here. What's the difference between palliative care and hospice?
And they're always lumped together too, so
They are.
it happens like it seems like the same thing almost to some of us, but those of us in the medical field or have had medical experience,
So,
delineation.
follow-up.
Yes,
So who decides who goes where? Is it by doctor or family or what?
both. I mean, a doctor can recommend, but the family ultimately and the individual, they're able to make that determination.
What if you're one of these people like me that say, and I'm not there yet, I hope, but I come up with stage 4 cancer, and I decide I don't want to have 18 months of torture going through chemo. I just want to go straight into palliative and say, well, it's going to be over. The heck with it. So as a person or a family, do you have that choice?
Absolutely,
You can turn down chemo?
absolutely.
Okay.
Yep, you would get with your physician, your doctor, and you would write your plan, your healthcare plan.
Yes.
Is that covered by insurance, and if so, for how long?
It depends on your insurance plan.
Yeah, okay.
So it would be something like, if that's something that you to that point, you need to consider that, you would probably, and I believe our staff can help navigate that for you and help find out the information that you're needing. Do we have a nurse navigator in that area? I think
We have the nurse navigators more in our cancer care unit. However, there is another best kept secret, as Sandy had alluded. We have a lot of case management and social workers at our hospitals. And sometimes when someone is truly in need, they don't ask for help. So sometimes people, maybe their neighbor or their family doesn't realize that there's some kind of issue where they need help. But it presents themselves when it impacts their health, and they have to take, a trip to the emergency room, and now they're an inpatient. And then we have case management and social work meeting with these patients, and we're finding out stories that, they don't have electricity, they have no food, they have, all of these lack of resources. So we have a whole team of people at our hospital that are working with this patient, not just to get them discharged, but to help them put their lights back on, to help them get food on the table, to sign up for SNAP or WIC or food stamps, whatever the case may be. So we have a whole team of people who are not just treating the symptoms, but are trying to get the person back on their feet. And when I started working here, I was just amazed at the team that we have. And both hospital systems have those teams here, and those people don't get a lot of credit. And I like to give them credit where credit is due, because it's pretty awesome.
that's a good point. I know we have a time limit. I've taken up a lot of time. I want you to hear the presentation from Dusty so you can see how your funds were utilized. So Dusty Chase.
So I'm Dusty Chase, and I'm a physical therapist with Franciscan Health, and I have worked there since I graduated from PT school 19 years ago. And I feel like it's a wonderful organization, and it's exciting to have the foundation. I can't tell you how many times our department alone has reached out to the foundation when we discover a patient needs help with maybe their lymphedema garments, which are costly and insurance doesn't cover it. Or some people come to our facilities and they have bed bugs. And we don't want to just send that person home to an environment that continues to have them. The foundation has been super beneficial to help those patients get the help they need to exterminate their home. So I'm excited that the foundation is a part of our organization and have helped our department tremendously. But I want to share with you, I'm so honored to be here. We are excited and passionate about what we do. So we have an occupational therapy, physical therapy, and speech therapy that treat our pediatric population. Our biggest diagnosis that we see are children with sensory integration disorders. And I'm going to kind of go through what that means and then show you the equipment that you purchase to help with our department. So children with sensory processing dysfunction, a lot of times you'll hear about autism. Many of those children have sensory processing dysfunction. But there are also children without that diagnosis that also have this issue. And they have difficulty regulating their behaviors to certain stimuli, whether it be sight, sound, taste, touch, and movement. And they have to find ways to calm and soothe themselves. And sometimes it can be very harmful to them or disruptive. We have kids who bang their heads, who yell, scream. You've probably been in a grocery store where a child has had a meltdown. Sometimes that's not the parent's fault or a lack of discipline. Many of these children can't regulate all the sounds and that sensory input that's coming in at the grocery store, and they don't have a way to understand and deal with that, so they have a meltdown. So be patient with those parents. It may not be something that they can really control, but they come to our clinic to help with this. Some kids run away. So we have runners, and we have to make sure that our treatment areas have doors and ways that aren't super easy for a child to get out, because we have kids who just get overloaded and take off. So sensory integration therapy involves a lot of sensory equipment that can either calm or excite the senses. It allows children to be in an optimal state to handle the sights, the sounds, the touch, the taste, the movement, in order to participate in their everyday tasks. It motivates the patients to participate in therapy that can be challenging and lead to greater independence with participation in play, school activities, and home activities. It provides an environment for those with inattention or hyperactivity. It increases the participation for children who have difficulty interacting with adults. You see that a lot with the autism population, where they won't look at you, they won't hug you, they won't engage with you. And it allows the therapist also to work on some visual skills. So our impact with this sensory equipment that you donated, we estimate that we have at least 10 patients a day that will be able to utilize this equipment. And the sensory tent, which I'm going to show you here in just a minute, allows the portability. So we have a sensory room right now, but what we've been finding is well utilized. And there's times when a patient's in there and another patient maybe needs to utilize it and they can't. And so you purchased, that grant money purchased 2 what we call sensory tents. And I brought one with me, super portable. I'm going to set it up and you guys can come look at it here in a minute. I've got some pictures of it as well. So that means if a child has a meltdown in a session and we need to, maybe the sensory room is being occupied, we will be able to bring this tent in to help with that. So the impact to our patients is improved outcomes, increased satisfaction, increased referrals. So physicians that know that we have some of the sensory equipment will begin to refer patients to our facility for this type of equipment. And then it also increases the community awareness. So you're seeing now in museums, airports, there's actually sensory rooms, and they are recognizing the need that particularly children, even some adults, when they're in these environments that are very overstimulating, they need some place to go to help calm them. And so you're beginning to see some of these sensory rooms in the public areas. So this is our bubble tube. So this is one of the items that you purchased. I took some pictures because I'm hoping my video on my next slide shows. I just did a video of it. So it is a large tube. It's 6 feet tall, and it changes colors, and it bubbles, and it has some fish in it. And and we've got mirrors mounted on either side of it so that it reflects, and it looks like there's multiple tubes when there's only one. Oops, sorry, go back. Can you see if you hover over the picture, if it will play? Oh, there it goes. So as you can see, it changes colors. You can set the speed as to how quickly the colors change. Oh, it stopped, I think. And the amount of bubbles. You can regulate how many bubbles are coming through the tube as well. So it goes through the whole spectrum of colors. And again, the kids just absolutely love this. And it's hard to tell. I've got mirrors mounted on, you can see it reflected on the mirror on the left. There's also a mirror on the right too. If you're at the right angle, it will reflect on that as well. So this is one of the items that we purchased with your grant. Oops. The other item is we've got 2 of these sensory tents. And like I said, I'll set one up here in a moment for you to see. We have small projectors that can project stars and moons and waves and different things that we can set in the tent. The child can be put into their tent with different fidget toys. And so these kids they need to be able to be doing something. And so there's fidget toys, and I brought some of those for you to look at as well. And so they can go into the tent. We can put the screen on so we can still see in, make sure they're staying safe, or we can keep it open depending on the child. And then the bottom picture is one inside the tent with the projector on, and kind of how that looks and what it feels like for those kids. So I know you guys, I'm really encouraging you to go over and take a look at the new YMCA. It is a partnership with Ivy Tech, the YMCA, and Franciscan Health. All of our outpatient adult and pediatric services are located on the 2nd floor of this new building that's attached to the YMCA. I've been over already several times. It is absolutely amazing. The YMCA part is just incredible. And then we are so excited to have that partnership because they have a large daycare and JA services. And we'll have our sensory room in the new facility. And so we are super excited to be able to move over there and to really look at the wellness opportunities that will be available for us. So I also just wanted to share a thank you note from our therapist. And we had some of our kids who utilized the equipment just put their handprints on a poster board for you. But the letter says, on behalf of Franciscan Health Lafayette, we would like to formally thank you for your generous contributions to our pediatric therapy department. The sensory bubble tube and 2 sensory tents that were purchased with funds from the grant have made a positive impact on our therapy environment, providing shelter for the overwhelming sensory stimulation. In the sensory tent allows patients the opportunity to calm down and feel safe during challenging tasks. The bubble tube is very relaxing and is an inclusive activity for the children of all abilities. Thank you again for your support and kind donation. Thank you again. And I'll set up the secretary.